Let me welcome you all to Fermanagh House, to Enniskillen, and most importantly to CHITIN, the Cross-Border Healthcare Intervention Trials in Ireland network. This has not happened overnight. It represents a lot of painstaking activity, discussion and involvement and contribution from a range of people in and around the last 5 years.
The CHITIN project was created through a partnership between Health and Social Care R&D Division of the Public Health Agency in Northern Ireland and our long-term sister organisation in the Republic of Ireland, the Health Research Board. There's not as much opportunity for involvement in research or trials outside of major cities and centres. That was the essence of our proposal. HRB and ourselves came together and put a bid to the SEUPB under the health priority, and we're lucky enough to be funded to the tune of €8.8 million. We were able to select 11 cross-border healthcare intervention trials. It covers a huge range of health areas such as asthma, diabetes, mental health, stroke, all age groups right through from prenatal right through school age, young adults and older people as well.
It's almost inarguable that the most important aspect of healthcare intervention trials is the patient, and as part of the HRB's strategy, a big focal point for us was developing public patient involvement as a key principle in clinical research.
Had I been put on treatment beforehand, I probably wouldn't have as many lesions on my brain as I do now. But you can't change the past, but you can do something about the future. So that's really why I decided to take part in a clinical trial.
By the time I reached 30, I had deteriorated so bad and fast. So when I was contacted by the MPS Society that there was a clinical trial started for my condition, I knew because of my poor health condition that I was willing to try anything and had nothing to lose. To me, being on a clinical trial did not just change my life, I really do believe it did save my life. It has been that important for me.
Under the health objective, we have €60 million, which has been allocated and to various projects. And this one specifically is dealing with greater cross-border cooperation and contributes to more efficiency in delivery of healthcare services, and we're very, very pleased about that in the SEUPB.
We have lots of evidence and history in collaborating North-South on health issues. Some of you would be very familiar with the service aspects of things and with the services for children with congenital heart disease, where we've had a very strong collaboration. And indeed, when we had various crises in those services, including outbreaks of infections, we worked really well together to look at developing the evidence base to intervene and support patients and parents through that. And that evaluation and learning is very important to those of us who work in government, because ultimately we have to shape the policy, the strategy, seek the funding and look at new ways of doing things. So we really need these networks to work and be successful.
CHITIN may be a new chapter, but as many of you will know, for many years the two departments, North and South, have worked together to fund All Ireland initiatives in health and to foster cooperation both at the level of policy but also in terms of service delivery. Research contributes to health both directly through therapies, interventions, diagnostics, technologies and quality improvement in healthcare delivery. And that's really where I think health research has such an important role to play. It sets the research and policy agenda in that it actually is really important and is being used to help design and implement policy.